Hey Yonkers, it's Mayor Mike Spano. For those of you who celebrated Passover, those of you who celebrated Easter, and we're just coming out of Holy Week, so I want to again wish everybody a healthy holiday. I'm joined here with a couple of people. I mean, you all remember Dr. Mark Marne from last week. We also have our police commissioner, John Mueller, who's with us today. And of course, we have the Office of Emergency Management, Mike Masiello, and in the wings, because there's no room at the table for him, is our Deputy Mayor, Jim Kavanaugh. We have been, as you know, dealing with this coronavirus, COVID-19, for now about 4 weeks. It's wearing, obviously, very taxing on the residents of our city, on each and every one of us. But we are in it together. We have lost a number of loved ones. For those of you, I'm sure saw some of the social media over the weekend, we lost Detective Bill Sullivan, a very near and dear friend of mine, a friend to many, a highly decorated police officer, a detective who did so much for our community, and who has a wonderful family. He has 2 kids. One's a teacher. One is a police officer, Will the third, and of course Eileen is really the solid as a rock for that family. So my condolences go off to the families, to that family, to the Sullivan family, also to some of the other families. I know we lost a Teamster yesterday to the coronavirus, and we lost someone who worked over in central staff to the coronavirus, and there are many others. But let's offer my condolences to each and every, our prayers for each and every one of them, and certainly our condolences to the families. I'm going to go off because I know there'll be many questions, so I want to ask some of our guests here just to say a few words, kind of give us a state of where we are and where we're heading, and things that we could all be doing. So I'm going to start off with my left, with Dr. Mark, and ask him to say a few words.
Thank you, Mr. Mayor. So, as you all see by the situation on the news with the governor, we're starting to plateau as far as the number of cases. Here locally in Yonkers, our hospitals, St. Joseph's and St. John's, Riverside, we're handling a large volume of cases. We've seen the plateau start. It's not as much of a peak. Think of it as an upside down U, where the number of cases are kind of starting to stay even, if you will. This is very important because it allows the system to absorb the number of patients that we're seeing and treat them adequately. We don't want to have a surge where we have more patients than we can handle in the hospital at any given time. So that's kind of where we are in Yonkers. And I'd like to reinforce and recommend social distancing. Again, this does help. It does work. It decreases the spread. It allows us to treat our patients, your families, your loved ones. So keep doing what you're doing, stay home, follow the recommendations, wash your hands, and so on and so forth.
Thank you, Doctor. We are also, for the first time, but somebody's been working for us around the clock, providing for the health and safety of our community. That's our police commissioner, Commissioner John Mueller. So.
Thank you, Mayor. So the Yonkers Police Department has been hit fairly hard with COVID-19. Obviously, as the mayor said, our condolences go out to the Sullivan family. It's a very difficult time for us, and we would appreciate that you would extend your thoughts and prayers to the Sullivan family. As the mayor said, Eileen's been amazingly strong, but we need to just keep them in our prayers. God bless Billy Sullivan. He was an amazing guy I worked with. As far as the Yonkers Police, we now have 45 officers that were tested for COVID-19 that came up positive. Many of them have come back to work. The symptoms have not been such where they've had to stay out for a long period of time. We are seeing our absentee rate improve in the right direction, where more officers now are back to work than they had been primarily before this happened. We've taken a number of measures that the public should know about as far as keeping our officers safe so we can continue to serve the public. We closed our precincts early on, and we have one centralized location at 104 South Broadway. In the event that someone wants to have a face-to-face with a police officer for walk-in complaints, which traditionally has gone to our precincts. We have gone to 12-hour tours where it's our feeling that we can stretch out the time that the officers are off, so they're here a little bit longer, but they're also home a little bit, a few extra days. So that's very helpful us too, as far as following all of the CDC and New York State Department of Health guidelines. We've moved to one-man cars, so a lot of people have been making inquiries with regard to why there's so many police cars going around. Obviously, with the social distancing guidelines, and again, in following the CDC guidelines, we now have one-man cars as much as we possibly can, which also keeps our officers safer. And I don't know if you want me, Mayor, now to go into social distancing, but that's the update. Okay, so one of the things we were seeing was that we need people to cooperate as much as we possibly can. And in doing that, we set up social distancing details that took place Friday, Saturday, and Sunday this week. It's really a media campaign more than anything. We're going to areas that our commanding officers in each precinct have identified as locations where there seems to be an uptick in activity that's kind of counter to social distancing and keeping us all safe and healthy. And what we found overwhelmingly is that the public in Yonkers is incredibly cooperative. So even when we do find people gathering together in a manner that's not really consistent with what the CDC needs us to do, they cooperate once we come up. We have card stock that we hand out about what it is we need to do. We have not had to make any arrests. We have not had to write any summonses. A lot of it is just dispersing. What we're finding is, and again, this is a cooperative effort from the city of Yonkers and the police department to make sure that everybody just does their part. We believe in the philosophy of persuasion over power. We're not looking to turn this into a situation where we're summoning people. We have that at our availability if we need it. But in the meantime, we're finding that most people are being very cooperative. We've been dispersing groups playing sports at the local parks, which again is not consistent with CDC guidelines. The mayor has been great in keeping the parks open. But our request for the public is, we know that people are all getting cabin fever right now. We know that people are all wanting to get outside, and the mayor has allowed the parks to stay open with that in mind. But we're just asking people, take this great opportunity with the parks being open and just maintain your social distance, maintain the things that we need to do to keep ourselves safe while you can still get outside and get some fresh air.
Great, thank you, Commissioner. And before I go to Mike Marciello, I'll just something just to remember, just to focus in on. Going through this pandemic, it's clear that we have to have one leader. Our leader is the governor, Andrew Cuomo. Andrew Cuomo has daily press conferences. I think that he's doing a wonderful job. And he has given us the guidelines that we have to follow. We followed our chain of command right on down because that is the best way to squash the curve, to flatten the curve, whatever way you want to talk about the curve. And we can see that maybe it's starting to take effect and maybe it's starting to work. And so, again, thank you to our governor. Also, we have the Department of Health. And Yonkers does not have its own Department of Health, but the city takes advice from the Department of Health as to where we go and what we do, what are the guidelines and what are the things that we should be doing. So we have, as you all know, we are all practicing social distancing. We ask people to wash their hands as much as possible. We ask, for people to stay home, because that's the best way, stay home. We have not closed the parks because if you're healthy and you need a little exercise, you're not at risk, then you know what? Go for a walk. Go for a walk in the park, go for a walk down the street. But do so, wearing a mask and practicing good social distancing. And remember, the kiddie parks are closed So if you go into one of our city parks and you see kiddie park, we have not been able to sanitize them. So we don't want you want to put our kids or anybody at risk. So please don't use the kiddie parks. Are there any questions yet? Oh, okay. So there was a question here about giving a breakdown of the coronavirus cases in the city of Yonkers by zip code. It really should surprise nobody that the most heavily populated zip codes are exactly where the most of the numbers are. 10701, 10705, 10704, in that order. 10701 has the most of 682 confirmed cases. But we don't see anything, doctor, unless do you see anything out of the ordinary? It just happens to be where the big population centers are?
Yes, it happens to be where, like I said last week, larger densities, more dense areas are going to have more cases. These people are in closer quarters as well. So this is consistent with the population of Yonkers, that we have higher numbers here.
Okay, great. And some people have said that to me too. Some people have said, Yonkers has the most number of cases in Westchester County. Well, Yonkers has the most number of people in the Hudson Valley, and so north of New York City. So that again, that should not surprise any of us. Will Yonkers follow New York City's lead and close the schools for the year? Again, that's not something that this administration will, that's not a decision that we will make, though it is a decision that we may have some input on, working with the governor's office and with the superintendent, Dr. Casato's office, and we'll make a determination as we move forward. But at the end of the day, that decision will not be made from this office, but it will be something that we will follow through. So are you activating, I'm sorry, are we asking the state for a testing site? We have asked the state. I know that Councilwoman Williams and the council president and Councilwoman Pineda Isaac and many others have asked for a testing site to be put in Yonkers. So we are, the council passed a resolution. I agree with that resolution. And we are making the case with the governor's office, with the state, with the county, in an effort to get a site here in the city. If not, there are plenty of sites around the city in terms of for people to go to and be able to be tested. Plus, you'll see that the testing locally is becoming more and more available as we level off on our plateau with this COVID-19. Doctor, how important is it for recovered COVID-19 patients to donate blood for antibodies? And is it important, is there somewhere locally or in Yonkers or Westchester County where people can donate?
Well, I do think it's important for patients that have recovered to donate, because the more plasma we have, the more trials we can do and see if this is actually helping patients or not. So my answer would be yes, it is important to donate. As of now, we don't have a center in Yonkers for patients to donate, but I do have a website where we'll share later, and patients can log on and set up an appointment for them. But locally here in Yonkers, we do not have a center for them to donate.
Okay, great, thank you. Thank you. I'd like to, I know I got one question here, but is there a place where people can donate masks? Mike?
Yes, we're accepting donations 24 hours a day at our warehouse, which is on 789 Sawmill River Road. We have a drop box which we check regularly, and for the most part, it is manned during the day. And you can email me at michael.monciello@ypd.yonkersny.gov. At any time, I'll get back to you, and I can even arrange pickup if necessary.
Great, thank you. What are some of the things, though, if you keep on Mike a little bit,
well,
that OEM is doing? Can you give us an update?
Daily. A great deal with YPD. We've been working on some innovative ways of sanitizing their cars and supplying everybody with PPE. But at your request now, with the new order that Governor Cuomo came out with, that all essential workers have masks. That is basically going to be our focus today and for the rest of this week. We currently do have enough for everybody, and we're still trying to be conservative, but we're working on acquiring more and making sure that everybody in the city of Yonkers, essential worker-wise, is provided with a mask.
I know Jim Cavanaugh is here. Jim, if you have a second, just to give us an update on distance learning at the Board of Education.
Sure. So the school district has been up and running for a couple of weeks now on distance learning. They have supplied, I think at this point, at least 500 students with either iPads or home computers, because we know that a lot of our students, some of our students are homeless, some are in low-income households that might not have this equipment at home. So we've been fortunate enough to be able to supply students with this equipment. And distance learning is up and running. We're getting good reports. And at this point, no one wants to say whether the schools are going to open this year or not, but Superintendent Quezada is prepared for them not to open. So if they don't, we will be able to provide distance learning for all Yonkers students through the end of the school year. We continue to operate the grab-and-go breakfast and lunch centers. There are, I believe, 7 or 9 of those. They're up on the city's website. They're up on the school district website. So anyone who wants to get a free breakfast or lunch can go to one of those locations. Those are available to anyone. And I think that probably wraps up in terms of school learning and school services.
Thank you, Jim. I appreciate that. I also know that there were a number of questions in regards to the Board of Education, the central office. And so I just figured I would just give you a couple of notes on what's happening in central office. We're practicing the same rules that we're practicing here at City Hall. They are in Larkin. There's no more than 35% of the BOE central staff is allowed to come to work daily. So there's good social distancing going on there. It's a skeleton workforce. As many people as we possibly can are working from home. Only essential staff has been coming in during the day. When someone walks into that building, everyone that comes in is having their body temperature taken by someone who's a part of the medical staff for the Board of Education. Everyone is expected to wear a face mask, and they are provided to everyone. And the building has been sanitized daily, or at least 3 times a day, by the custodial staff. So I think they are doing everything they humanly possibly can at the Board of Education to protect the workforce. And I want to say thank you to not just Dr. Quezada, but thank you to the team there, especially the sanitary team that's out there doing that work for us each and every single day. There are a number of questions here. One about parking meters. We are not, since most of our parking meters, 99% of them are in business zones. We're not going to offer free parking, but I will continue to suspend alternate side of the street, even though it doesn't allow us to clean our streets, and that's got me somewhat concerned, but it does provide more parking. The number of cases that are been infected in Yonkers is nearly 2,500, and so I want to just flip over to one of the other questions I think we have till, here we go, for Dr. Mark. Doctor, is Lawrence Hospital taking COVID-19 in regular patients?
I don't believe Lawrence Hospital is on diversion anymore, but I can speak about the Yonkers hospitals, St. John's and St. Joseph's. We are taking patients. We are taking COVID and non-COVID patients. We do have beds. We do have ventilators. As far as our local hospitals, we're up and running. We are taking patients. I believe Lawrence Hospital is as well, but don't quote me on that.
Great, thanks, Doc. One of the questions was, when will we get back to normal? I don't know, which I'm sure a lot of you feel the same way. I don't know what normal is anymore. I think that we've all, society's changed pretty significantly, and we're going to learn from this. We're going to adjust, and we're going to make changes for it. But I would imagine that as this curve starts to decline, that we'll start to see some type of normalcy come back. Doctor, is there any place a person could be tested to see if they do have the antibodies so that they can help somebody if they want to?
So this has come up quite a bit over the last few weeks, and it's with respect to convalescent plasma. These are patients that were infected with coronavirus and have recovered from coronavirus. What we recommend is to go on the website. It's NewYorkBloodCenter.org. That's NYBloodCenter.org. When you go on that page, scroll down to the tab that says Convalescent Plasma Information. Click on that. Inside, there's another tab that says I'm interested in donating. Now, there's a form there which you'll need. First of all, the patient should have been positive, of course, and recovered. And we need the date of the test, so you'll have to put that in there. And you'll have to upload a document from your provider that you were tested positive. Also, the patient should have been 14 days since the last symptom. You also need the date of the last symptom. And then your contact information, and you upload it. This will, they'll reach out to you and give you an appointment of where you can donate. As far as the Elmsford location, they're not taking walk-ins for convalescent plasma as of now. I looked into that last night. So our best bet is to go through the website and see where they'll do it. Now, as far as antibodies, there are a few different tests to look at if one has corona or not. Currently, the swabs are a PCR test. It looks for genetic material that's in the cells. It tells us if there's active infection. Antibody testing looks at different antibodies, one of them being IgG, which tells us that the patient has seen the virus, the body's immune, has seen the virus, and has made antibodies. The other one is called IgM, which we many times test at the same time. That tells us if there's an infection happening in real time, which is acute. So these tests are going to be more available. Our governor does want them rolled out as quickly as possible. So within the next week or so, I think we're going to start seeing more of these tests come out. These are very important tests because they'll tell us who's seen the virus, who's immune to the virus, who has the virus, and they may be a bit easier to do because they can use a blood sample and we get a result back quickly, as opposed to a nasal swab where we put a big collection sample through the nose. It's a bit uncomfortable. So that's a little bit about testing, and within, I think, maybe the next week or so, we'll have some more information about where that's going.
Great. Thank you, Doctor. I know that the police commissioner has a couple of questions that were coming from the viewers.
So this question was for me and the mayor. It said, what have you learned about this and what would you have done differently? So that's a great question. I think that as police commissioner, what I've learned is, no one really saw this coming, and it fell on us pretty quickly, like it fell on the rest of the world. And I think that I would have liked to, in foresight, to had more sanitizing equipment, commercial equipment that would allow us to easily sanitize our facilities. As far as what I've learned that this city and its residents are incredibly resilient and incredibly cooperative. I've learned that my officers and supervisors in the YPD, as well as the rest of the first responders, are nothing short of absolutely heroic. The notion of the work we do, of reaching out to people and connecting with people, it's just so, right now, it's just so counterintuitive not to be, engaged with people on a person-to-person and a very human basis. And that's really hard for us. But what I've learned is that, we don't know the date and the time of when this is all going to end, but I do know it is going to end, and I do know that we are going to get through it. And I've just been absolutely floored by how great our public has been in terms of being cooperative. The outpouring of love and prayers for the loss of Detective Sullivan. and just the incredible work that our officers and supervisors are doing each and every day. You know, we don't have the opportunity, nor do the firefighters or Empress, to work remotely. We have to be out there. We have to make sure that we're ensuring that our public is safe and secure, and then with this added burden of trying to make sure that people socially distance and they follow CDC guidelines. But the truth is, we've gotten nothing but support and cooperation, and we're hoping that that continues.
Yeah, what I've learned is a couple of things, actually. Number one, I look at the national experience is that, you know, clearly this country's prepared for war, this country's prepared for terrorist attacks, this country's prepared locally for hurricanes and blizzards, but not prepared for this. And this pandemic it's hit us, but I agree with the commissioner. The city's been incredibly resilient, and you know, and I always brag about Yonkers because Yonkers is the kind of city that you need to know how to hug somebody because we like to hug, and so you know, when you're having social distancing the way we're seeing it, it's makes that hugging process a little more difficult to accomplish, but. We do love and care for each other, and that's why I continue to say, look out for the neighbors, especially if they're senior citizens. You know, make sure you have their telephone numbers, call them once a day, ask them if they need any groceries, drop it in front of their doorstep. You don't have to have an interaction with them except by the telephone, but then leave the food at the front door. Make sure they're okay. Look out for families that have you know, kids with compromised immune systems. Look out for your neighbors. And you know, Yonkers is a city with 200,000 people in it. It's a lot of people squished into 18 square miles, but it is a very easy, very close-knit community. You know, we always kid around about our city, saying about how it's a big city, the fourth largest in New York State, but we act like a little town. Everyone knows each other. Everybody knows everybody's business. I know that there's a question here about the passing of Detective Sullivan and how it's affected the morale of the officers. I mean, I'll let the commissioner answer that question, but I will say that, like I said, Detective Sullivan and I go back since when we were kids. We've had some wonderful memories we've shared between our two families, and you know, I'm going to miss him terribly, but he was very much a part of this administration, aside from being a part of this wonderful police department. But I know that what I saw yesterday was really good for the soul. It was what we saw yesterday was where people, what this disease has done to all of us, I think, it's made us feel somewhat helpless. You know, if someone passes away, you can't do anything. You can't hug them. You can't go to a service, and that's a horrible thing to have to deal with. But what we saw yesterday was the police department and the people of Yonkers reach out and take control and do a memorial motorcade. We did something, and we did something for that family, and we did something to recognize Detective Sullivan, and you know what? And we did something for the people of this city. It had an effect. It made me feel good. Most every police officer on the job was out and a part of a Detective Sullivan's life yesterday. You know, celebration of his life, because that's what we attempted to do by paying respects to him and his family. So I'll turn this back over to the commissioner.
Yeah, just to jump off on what the mayor said, you know, it's just this whole situation for all the people that we're losing is just so counterintuitive to how we mourn as Americans and human beings, that we embrace each other. We go to wakes, we go to, you know, luncheons after a funeral, and, you know, right now we can't do anything like that. And, you know, there was a small, very organic idea initially about how we could honor Detective Sullivan and the work that he did in his life, which was incredibly amazing. I had the pleasure of working with him in the 4th Precinct. And so this all came about in about 16 hours. And, this was not a funeral. We can't do that right now. And so as the mayor said, we just put together as best we could how we could do something for Eileen and her children and the Sullivan family and all the people that loved Detective Sullivan in a way that corresponds with what CDC wanted. And so that was a procession. If you look on our Facebook page, our officers all were wearing masks. Our officers were all 6 feet apart. So we did the best we could with the situation that it was. And I'd be remiss if I didn't call out a few people that put this together and did an amazing job, Mayor. Lieutenant Rick Alamo handled the actual the muster at the 4th Precinct. Lieutenant Sean Mullins was in charge of procession. And we had great cooperation with our 2 unions, Detective Keith Olson, president of the PBA, and Detective Sergeant Mike Koch of the CLSA. And one of the things that this has all done for everybody is really brought us all together. The officers are incredibly resilient. They're hurting right now. They're in pain. When I was driving down to get to the ceremony, one of the things that really touched, that you don't remember sometimes, is that as we were doing it, officers are still going on assignments. It doesn't stop. It doesn't stop for anybody, and I think that's the nature of the work. And one of the things we tried to impress to everybody is, what would Sully want yesterday? And what he would want is that he would want everyone to be social distancing. He'd want everyone to be wearing masks. And so that's what we did. And again, I can't say enough about how our police department, no surprises, we're not surprised about the great work that they do and how they come out in force for something like this. But I hope that it gave some solace to some of the family. I know it did for me, to kind of recognize Sully in a way that, the way the environment has created how we can do these things. So just thank everybody for turning out. I mean, incredible. I was behind the mayor in the motorcade, and the amount of people that came out, the signs, the flags, just absolutely heartwarming.
It was a beautiful, beautiful send-off for a very, very special person. And it was nice to see participation from the people of our city. Like I said, it wasn't just police officers and firefighters and Teamsters, but it was everyday Yonkers residents who took the streets, who actually had signs. We have so many signs
Yes.
that were put out there recognizing Detective Sullivan and his family, so and the Yonkers Police Department. So to talk about a couple things real quick, because I know we're going to be winding down. The gloves and and some of the medical stuff that you're seeing on the floor, I think we can all see it. It used to be plastic bags, now it's gloves and mask. Well, we will, our codes will enforce the ordinance, and so if this stuff, remember that every person in Yonkers, every property owner is responsible up to 18 inches of their property. And so if, from the curb, by the way, 18 inches from the curb out. So the city will enforce those ordinances, and so I ask that if you see anything, that you pick it up. Also, the city has been, you heard the commission talk before, has been going and really enforcing the law on social distancing. So try to pay attention to that. The elections have been rescheduled to 6/23, June 23rd will be the primary. So know that you'll hear more about that as we get closer to that date. With that, do you have any final thoughts, Doctor, that you want to share?
Yes. I would like to just reiterate one more time, if cooperation with social distancing is very, very important. We want to keep this curve flat. We want to keep this curve the way it is and improve things. I know everyone wants to get out, everyone wants to get back to normal, but we want to save people's lives. These are your loved ones, our loved ones. So please stay at home as much as you can. If you need to make a run for groceries, try to buy things for a few weeks at a time. This way it decreases your time outside of the house. Wash your hands repeatedly, 20 seconds, soap and water, 6 feet away from people at least. And I'd like to thank the staff at St. John's and St. Joe's, particularly our nurses, nurses' aides, the phlebotomists that draw the blood, the respiratory therapists, the radiology department, the ancillary staff, maintenance, and of course administration, as well as our doctors, because everyone's really stepping up. Everyone's working. Hospital capacity is up to 200%, but we're the same amount of people, and everyone's really working hard. Thank you all.
Thank you, Doctor. Any final thoughts?
I guess the final thoughts are that we will get through this, and we're going to get through this together. And as the doctor said, cooperation and coordination is very important right now. If we can just stay the course, there will be light at the end of the tunnel. We need to work together. We need to help each other. We need to lean on each other, and that's one of the greatest things that comes out of the Yonkers population. So we will get through this together. That's my message.
Mike Masiello?
I would just like to thank all my volunteers, because the Office of Emergency Management works mostly on volunteers, and these guys are putting they're putting themselves out there just on a volunteer basis, and I think it's great. I want to say thank you to all of them.
Let me start by saying thank you, especially thank you to our friends at St. John's. I mean, I knew firsthand, watching Detective Sullivan and what he went through over the past couple of weeks, type of care that's being provided to individuals who are suffering with this horrible, horrible virus. So I want to say thank you to St. John's, to the entire team there. I want to say thank you to St. Joe's and obviously the medical team there. I want to thank you to Lawrence Hospital, though you're not in Yonkers proper, but we know that because you're on the line, you're servicing many of our families. I want to just again reassure the people of Yonkers that your city is operating the way it ought to be, and that there is there are a lot of people working from home. But if there are city services you need, go on YonkersNY.gov and look up that department. There are things you may need from the building department, parks department, tax office, any different office. Know that there is someone there and available to talk to you. Try to be patient, but there is availability for people to talk to you. Thank you to our police department and our fire department and our EMS services. Everyone is operating where they should be in this city. One of the things I learned is that I'm very, very proud of the people of the city. I'm certainly very proud of the more than 6,000 employees of this city, our teachers, everyone across the board, our CSEA workers. Continue to work hard, continue to make us proud, and we're going to get through this, and we'll get through it together, and hopefully very soon. God bless you.